Hi, my name is Gregory Kainholz, and I'm going to be doing this presentation on typhus. So typhus is a really interesting disease because it isn't contracted like it is with the flu or the cold, where some things are where the germs are airborne and it's on surfaces you avoid touch. Sanitation usually can prevent it. We have vaccines, medicine. Typhus is contracted through bites and usually through an arthropod, and each arthropod kind of carries a different strain, I guess you could say, of typhus. And the three main subcategories of typhus that we know and that we study more is the epidemic typhus, endemic typhus, and then scrub. So epidemic is interesting because it is usually found in dense populations, and we tend to see this more in third world countries where there is poor sanitation, lack of awareness, I guess, for this disease because it's not promoted. A lot of people fall ill and don't really understand why. And we'll talk about that more later on, about how misdiagnosing can cause more issues in the long run. But this strain usually happens in third world countries, which is really unfortunate, but that's where we see it the most. And then in the endemic typhus, it's also known as murine typhus. It's found worldwide, tends to be among people who come close in contact with rats, which is kind of unfortunate. So like I said, it really varies on who bites you, because if a rat bites you, that could be a different typhus than when a tick or a flea or a mite bites you. So we usually see that, and it's also noted that a lot of studies have seen this form of typhus, usually in Texas and Southern California. So it kind of raises question as to why that's happening, which I've also read a lot of articles where it happens in South America a lot, so that might be a contributing factor. The third one is the scrub, which is carried by mites. It's usually commonly found in Asia, Australia, and the Pacific Islands. And they think that's because it's more humid, it has more breeding ground for that to happen, and people are more prone to open skin, and you get more bites. So it makes you more susceptible. And people are probably wondering, like, how do you know if you have typhus? Well, all of them kind of present the same overarching features of symptoms, which is headache, fever, chills, and rashes. The rashes are usually the biggest indicator. They're small little dots and circles that kind of happen all over your body, and they kind of happen in big clusters, so it's noticeable. With the epidemic typhus, symptoms are sudden. People said that they can go from normal temp to 103, 104, instant headache, instant fatigue. People lose consciousness sometimes. It's a really sudden thing. But with the endemic, the symptoms last for 10 to 12 days. So sometimes they can seem more dormant than others, and it's less severe, but they have the same symptoms as the epidemics. It's just not as rushed and not as quick. And now with scrub, people face swollen lymph nodes, and it's a lot more prominent. It's kind of similar to endemic. They're all very similar in their overarching, like I stated, but their sub ones have different effects on them. And that makes it hard when they have these symptoms and similar, because it makes it hard for physicians to diagnose which typhus you have, or if it's even typhus. A lot of times doctors, when you bring it up, they'll ask you, what size of population do you live in? Do you know if there's been an outbreak, or if people have been feeling ill? And also they ask you if you've traveled abroad, which is another big one. It's hard to recognize because it's also similar to malaria and breakbone fever. So a lot of times medical professionals will think that that's it, especially when you don't know if a typhus outbreak is present in the community, because a lot of people may be misdiagnosing it or assuming it's something else, like the flu and all of those things. So a lot of times what they like to do is run skin biopsies, because you have the red marks, the flaky skin, the dry skin. And then they like to do blood tests, which is another great indicator for quicker results. And there is a vaccine that is available, but it's not used in America a lot because we're not prone to it. So a lot of times it's something that's brought up for people that travel abroad, but a lot of countries also have that readily available, for they know that is prone there. So in all, and to treat this, it's commonly used for antibiotics and stuff. Early treatment is important because delayed treatment and mixed diagnosis can lead to more severe causes of typhus, which just mean that it can lay dormant for a longer amount of time. Like, you can get over it, and then it can come back even more severe and make you more sick and have prolonged health issues in your life. So I think in America, it's not really an issue for people to worry so much about it, but it's also something to be educated on, because if you travel abroad a lot, if you are aware of people that you interact with that go in these locations and stuff, or you read stuff, then it's important to be notified of this and how to recognize it, because the long-term effects are a lot more severe for people, like going blind and having issues like that. So I think it's important to be aware, and this was my presentation on typhus, and I hope you learned something from it. Thank you so much.